There's a lot of mentally ill people living in Hannibal, and I think it is very sad that our only major hospital has turned its back on all of us.
All right, thanks, Mike. Hannibal Regional Healthcare System is closing its outpatient mental health services, and some local patients aren't happy about it.
The system sent out letters to patients, staff, and mental health providers to announce it will close by the end of this month. I spoke with a representative from the healthcare system about the reasons behind the decision and with a mental health patient who says the decision is going to cost her more money than she doesn't have. Mary Salenzi was diagnosed with manic depression with bipolar tendencies 3 to 4 years ago. Since then, she's been working with her psychiatrist at Hannibal Regional to get her medications just right. Now she says she'll have to find a new doctor in Quincy to manage her mental health.
It's going to cost me a half a tank of gas, a quarter tank each way. I can't get an appointment there until May 7th, and my last appointment with Dr. Spalding is the 13th of this month. Starting with a new doctor, all over from scratch with a doctor that has known my history for years, it's going to be very difficult.
Julie Leverin serves as Vice President of Strategy and Planning for Hannibal Regional Healthcare System. She says the system has been and will continue to work with Preferred Family Healthcare, Inc., another mental health agency in Hannibal, to strengthen behavioral health services.
We've been working for a number of years to try to bolster behavioral health services within our region. And one of the things that we've done is to reach out to other providers to try to determine what are the core competencies and what are the strengths we have among all of the providers in our region, and how can we leverage those competencies to expand the resources available.
Leverin says the closure is the result of a complicated array of circumstances. Missouri's decision not to expand Medicaid, challenges with the Affordable Care Act, and dropping reimbursements for providers such as Hannibal Regional.
But we now have a group of providers who are working collaboratively to seek solutions, and I have a lot of confidence that we're going to begin to see some expansion of services in our region.
Leverin says mental health providers cannot do this alone.
We've got to look to our state and our federal government and the reimbursement system to also bolster and strengthen the resources that are directed toward families affected with mental health issues.
Comprehensive Health and Mark Twain Behavioral Health in Hannibal also provide mental health services, but Salenzi says she doesn't qualify for any of the services offered at those other mental health agencies.
Well, Hannibal Regional basically says these people are going to have other providers here in Hannibal. Is that true for you?
Not for me, not that I have found. And I've been on the phone ever since I got my letter trying to find out somebody.
Salenzi says she's concerned about other mental health patients as well.
I'm frightened that they'll get lost in between the cracks and we'll have more problems because they won't have their medication. You know, they have to see a doctor on a regular basis to get their medication, and if they don't have a doctor, they don't get their medication.
Julie Leverin says a coalition is now in the process of assessing the area's mental health resources. It's made up of public administrators, private counselors, and law enforcement. You can find Leverin's and Mary Salenzi's full interviews at KHQA.com. Now, we spoke with at least one mental health agency in Hannibal to get reaction about Hannibal Regional's decision.
There are so many needs in our community that, currently weren't being met before Hannibal Regional closed their outpatient mental health department. So I certainly think this is going to increase the pressure on the system to provide enough services for the patients in this area.
Now, KHQA tried to gain some perspective on what's happening with mental health services throughout the state of Missouri. We spoke with Kim Gladstone, who is Vice President of BJC Behavioral Health in St. Louis. Gladstone told KHQA mental health providers in Missouri, quote, have the services, but we don't have the funding. She says a lot of good things are happening, but we don't have money to do it. When we don't have Medicaid expansion, we could be doing so much more. The good news is more people are reaching out for help. That requires money, end quote. We also called the Missouri Department of Mental Health. Our calls were not returned.